So at UNC we have this wonderful program where as part of what's called the health registry, and there's different parts. The health registry is where patients can sign up and be prospectively followed with quality of life data. A separate part of that is in the kind of the penultimate of that is a program called UNC, where patients sign up, and as part of that they can have their tumors sequenced with next generation sequencing to really be able to identify potential targets for treatment. Folks from Seek and the registry are embedded in our clinic, and as we see a new patient, they come and they consent the patients and talk to them. I've had patients come from other places just to be seen at UNC so they can have the access to Seek. In terms of what we do with that information, frontline for G1 oncology, there aren't a lot of options to be able to use the data from Seek, but when patients recur, it is a wonderful source of information that you can then talk again to medical oncology and see if they have a trial that can target that patient's particular mutation, which is really just a novel. I mean, no other place has something like this. And I think beyond targeting the therapies, we can start looking, well, maybe we should move this into frontline. Maybe it shouldn't be held for recurrences. Maybe we can combine it with standard of care to create a novel trial for patients who have these particular mutations. So I think it's a great opportunity. You know, I think as we do better curing cancer and we have more survivors, our patients aren't just going to be happy with getting through their treatment, and they shouldn't be happy just getting through treatment. They're going to want life after cancer, and using the health registry with the quality of life data there, and even being able to combine that with Seek. You know, are there certain patients that have certain mutations that don't do as well with therapies? Should we target those therapies different or adjust them so they don't have as much toxicity? I think it is just a wealth of information that we can use both for patients now as well as advancing our care in the future. So, you know, so many of our patients inspire us in so many ways every day. You wonder where some of these women get the strength to do what they do. There's always patients you're going to remember, and those are going to be really defining moments. But I think every day is sort of a reaffirmation that I made the right choice.